Good afternoon. Thank you for joining me here this afternoon. I have a mission and a job to do. We all as city officials have a job to do, and that is to make sure that the people and the families of Duval County, Jacksonville, Florida are safe. And the way we're going to do that is slow the spread of the coronavirus and eventually eradicate the spread. That's why it's important that you're getting information, that we are communicating with you, and that you're heeding our instructions. Last night, we learned of the first positive COVID-19 patient in Duval County. I want to provide a few updates about our continuing response and mitigation efforts. Last night, when first responders arrived on the scene, they had no indication the patient was possibly infected with COVID-19. Since the first responders were exposed without personal protective equipment, all 5 are now in quarantine. We know the patient came from a senior facility. Emergency management has been and is in contact with that facility. Jacksonville Fire and Rescue Department has now adjusted its policies to include additional levels of protection for first responders and patients to reduce exposure. Without having consistent information as to how many people are monitored, tested, or need to be tested, I have to act unilaterally, perhaps with actions that may be criticized in the future. But the actions I have taken, and those I will be taking moving forward, will be those that are thought most effective by local experts for preventing or slowing the spread of COVID-19. Doing so is essential to ensuring our local healthcare system is not overwhelmed and that the fewest number of people in Duval County are at risk. To that end, today, I am indefinitely suspending events and gatherings in city facilities. All city-owned event venues, including TIAA Bank Field, ViStar Veterans Memorial Arena, Times Union Performing Arts Center, and Prime Osborne Convention Center, will remain closed until further notice. We're also closing the zoo, all libraries, and public parks at the close of business today. In addition, I have ordered city departments to immediately suspend all permits for large gatherings and stop such gatherings at city parks or on city property through the end of the month. We are working with the Supervisor of Elections on plans to keep those libraries and fire stations that serve as voting locations open exclusively for early voting in the Tuesday election. The function of our municipal government must be maintained, but I am encouraging the strongest possible terms that people in Jacksonville minimize their in-person transactions at government buildings. If citizens do not need to come to these buildings and offices for the next few weeks, or if the business and information you seek is available through phone or web technology, please consider that instead. We are currently assessing the need for essential employees and will update at a later time. I want to reiterate that at this time, we have not declared a state of emergency, but that is something we may consider moving forward. Again, this is a very fluid situation. We are in constant communication with Jacksonville Transportation Authority, Jacksport, Jacksonville Aviation Authority, and all independent authorities, and will share any updates on their operations when available. We strongly encourage local businesses and organizations to take similar actions. We're not mandating any of this currently, but we want people to be cautious and thoughtful. As a reminder to citizens, if you are experiencing symptoms or if you feel you may have this virus, do not immediately go to the hospital or doctor's office. Call your physician or use virtual care. We do not want to overburden our medical system or risk exposure. With that, we'll take questions.
What nursing home was this person coming from? Do people in that area need to be worried?
The nursing home, they've been in contact with our Emergency Medical Operations Center and Director. Chief, do you have any details on this? Facility, or what do we know?
So the facility is a assisted living facility. We are currently have some employees, our JFRD employees, that are going out there assessing the situation and trying to make sure that it's following the protocols that need to be followed to ensure the safety of the citizens that are in there and the responders that are responding to that facility.
What facility is it? I think people should know.
Let's find out if under HIPAA,
Yeah.
if we could disclose that under HIPAA, we will get you that information.
Is it on the south side? Is it like in the area?
What part of town?
It's in the town center area.
Town center area.
So obviously, this is a concern since we went out there and there were these problems. Firefighters are now being quarantined or self-quarantined.
Jim, the situation is fluid, and the appropriate medical professionals are in touch with the facility. And as I committed to you in the last few days, we will clear with HIPAA what we can share. And if we can share, we will tell you exactly what we know.
Do you know if it was a travel-related case or was it from a social spread that this person contracted?
We don't know the answer to that question yet.
You want to talk about some of you're closing down parks, the library. What about those events that have been planned? Any ideas what's going to happen, particularly Hamilton next week?
Not happening.
Not happening.
Not happening.
Anything of that nature.
Have we worked through that stuff yet?
We will have to go call the venue, call the ticket, the sales point, and we'll provide the information as we get it.
Yeah, call the venue you get your tickets at, and we will be working to make sure that that stuff, those details are in fact worked out.
Are there any additional measures specifically that the supervisor of the election office is taking to make sure all of their devices are clean ahead of primary election day?
You've spoken to the supervisor?
We're increasing the cleaning and doing everything we can to clean the facilities.
All cleaning in city facilities have been magnified by a number of times.
And still, election day is still on.
At this point, that's correct.
So you said parks are going to be closed at the business day today. And what does that mean? I mean, kids can't go to a park and play with just their families?
Closed. It's closed. Yep. Look, I understand. I understand that this is disruptive and inconvenient. But we have to experience this disruption and inconvenience to slow this thing. We've learned from other countries and other places that have experienced what we've experienced now. Those are positives, that social interaction drastically slows the spread of this. And so it's incumbent upon me to make sure I do everything I can with the information I have to slow the spread of this and eventually eliminate it. We're all in our emergency operations center. They are a part of that. So yes, we are in communication. I do not have direct information as to what their immediate plans are at this time. So I think, as you know, the schools are independent of the city. The superintendent and the school board, they'll make that decision. However, I'm in constant communication with Dr. Green. And I have complete confidence in the way they're gathering information and data and how they will ultimately arrive at their decision. At this point, they have not said that they will close schools. I believe they are going to communicate with the media at some point today, and we'll all have more information at that point in time.
And the senior centers, those going to be closed as well as part of this?
Yes. All city, yes.
So Mayor, I know last night we were talking, you were upset with the health department, the state health department. Do you think you're going to get better communication now by taking these actions? What do you want to see happen?
I just want information. I want information so I can make decisions with that information. Decisions were like decisions we're making today, and I want to be able to share information with the public.
How long will the patient in the assisted living facility
It's a resident.
Mayor, you said indefinitely this could go on for weeks, months, nobody really knows how long it's going to take this to work through. Do you have any kind of ballpark figure for how long this is going to remain in effect for these widespread closures?
I don't.
How often are y'all going to reassess, and how will y'all decide?
We're looking at stuff not only every day, but this is our entire morning has been this, and even in the last number of weeks.
So any meeting next week, follow that council here at City Hall, the following week, City Council meeting hall, none of that will take place.
Those decisions have not been made yet. I'll work closely with Mayor Curry and his team to make those decisions as we discuss it throughout the day.
I know the council president has been in regular communication with our team and the general counsel to determine how to best move forward there. Sure, it's going to be painful, disruptive, but the health and well-being of our citizens and our families are number one.
Chief, I know that is a concern, but this patient, this person, was this somebody, was he visited by a traveler? Can you talk generic about that case? I mean, do you know?
We do not know. It's being investigated by the Department of Health, and like I said, we have some of our personnel that have gone to the scene as well, trying to help make sure that process works like it should.
Are you angry with the Department of Health putting your firefighters at risk?
We just need information. We just need it given to the mayor so he can give us guidance on the decisions.
Additionally, I've been on phone calls today in discussions about how can we get access to more testing? How can we test more quickly? Does the city have the authority and the ability to direct and dictate that? Those are the questions I'm asking now. He was in Jacksonville. He was in a hangar only with a very small group of people. They know who those people are, and they're taking the necessary precautions.
For people impacted by the cancellation of events, whether it might be Hamilton or anything, is there any refunds that could be offered to people? Or are you setting something up to address those?
Yeah, we're working through that now. At this point in time, people should call wherever they purchased their event tickets from, and my team will work with those venues to make people whole.
What about people that applied for permits, businesses, local businesses that now have events to cancel them?
We will work through the economic impact on them as well.
Since we know this patient is at Memorial Hospital, people there need to be concerned.
I spoke to the head of that hospital this morning, and he shared with me they took all the precautions they needed to take, and the patient is quarantined in a way that needs to be at this moment in time.
And I guess since you told us that the fire department didn't know that this patient was positive, and I imagine anybody living in that assisted living facility, whatever this is, they're all going to have to be quarantined, correct?
That's why the Emergency Operations Center has been in communication and in touch, and the Department of Health. Do we know what the Department of Health is doing?
No, they're going to take the appropriate measures. They have protocols in place, and we'll get an update on that.
What are, I mean, do you know, I mean, will every resident there, I mean, I'm sure that there's a big number of residents and families are going to be concerned. Will they have to stay there and let them visit them?
You know, the protocols are to try to limit the exposure not only to the people who may be impacted, but people who may be visiting them, and the Department of Health will take those appropriate measures. It's up to the Department of Health and their physicians.
Jim, I would again. I've asked the question, and we will certainly get the answer. I would like the city to be able to acquire testing kits, locations, and test people that need to be tested at our direction. We don't have that answer yet, but we want to know the answer to that question.
Did the patient leave the assisted living facility at all before he came into contact with first responders?
We don't know the answer to that question.
And that's the real danger of everything out there. You don't know, we don't know, and there could be a whole area of town affected. Is that a concern?
We need to make sure that we are keeping our distance from people, washing our hands. Look, we have a positive case now in Duval County. There are likely more, we would expect. And the way we slow the spread of this is to take all the precautions I outlined here today. It's a fluid situation. Could be in an hour, could be Monday, could be in a week. Depends on how things develop. Sure, state of emergency does a number of things. If the state has issued a state of emergency, it gives us access to funds, but also under the city charter, consolidated government, the executive branch, it grants me powers to make decisions related to independent agencies, and it just widespread decisions that I can make to make sure that the people in Jacksonville are safe, unilaterally. At this point in time, the schools are planned to be open on Monday, according to our school officials. And they are actively having the discussions right now about if they're going to continue with that posture. So what I would say to parents right now is, today is Friday. We've got 3 days till Monday, 2 full days after this, and just pay attention to information flow, watch your local news. And again, I believe that the superintendent's going to be communicating with media this afternoon, so you'll get more clarity. At this point in time, because schools aren't in today, students are on spring break, parents should not be concerned today. They should follow the information, and we'll all make assessments before Monday arrives.
Thanks, everybody.
Say again? Right now, under the direction of our superintendent, with the information I have, yes.
Thanks, everyone.
Thank you.